thank you for this opportunity to present our work today in this case study. So we are working in Nicaragua at one of the largest sugar mills in the region in Central America at Ingenio, San Antonio. And so we're working there to address excessive heat exposure in their agricultural workforce. And we've been there since 2017 in this particular mill, and the work is ongoing. So engaging with stakeholders has been a real priority for this project right from its initiation, and our aim is to engage with stakeholders right across the global commodity chain, and the commodity in this case is sugar. And so we work with workers in the communities that are affected right through to international organisation trying to promote and advocate for worker protection. And this is because climate change is looking ahead. Global temperatures will have a direct impact on the heat stress and heat risk for these workers. And in parts of the world, workers, particularly manual workers, performing strenuous labour in hot environments are already in a precarious position in terms of their level of risk and the health impacts that has, and this will only increase with climate change and water shortages. And so these impacts have occurred at individual levels, so there's an increased risk of acute heat injury or illness, increased risk of accidents, and also long-term health consequences that can be very serious and even lead to death. Of course, these individual impacts have societal impacts as well. We see a decrease in productivity associated with excessive heat exposure in the workplace, and this has social impacts. The economic consequences of that drop in productivity impact society, and of course those health consequences impact societies and communities as well. And there's also an impact on local health services, particularly if they're already under pressure in developing regions. For our work in the region that we're working in, there is an epidemic of chronic kidney disease of unknown origin, which is really driving our work as well, because a primary factor for this disease is occupational heat stress. So we're really looking to try and address that and prevent the loss of generations that have gone ahead of us. So that's a key driver for us. How are we addressing this? Well, we're putting into place a workplace intervention within the mill that we're working with. It looks very simple at the surface, but we're trying to provide adequate water, rest and shade for workers out at risk of heat stress. So having regular breaks and also ensuring that workers don't work during the hottest part of the day. When they do have breaks, ensuring that there is shade and adequate water, clean, safe water for them to access as well. And so this is what it looks like in the field. We have tents that need to be mobile to be able to move to where the workers are working, and also to adjust and provide shade depending on where the position of the sun. We also need to have water that is cool and accessible to the workers, and of course sanitation. As soon as you start providing hydration, you need to provide adequate sanitation as well. So this is what we're working on. In terms of our progress to date, well, we're really pleased to see that there's been a positive impact in the workers' health profile that we've been following since 2017. So we've seen a reduction in heat stress events in this worker cohort, and also very important for us in the region, in the area that we're working, we're also seeing we're maintaining their kidney function, and that decline is being reduced, which is hugely important. Another important impact from the work that we've been doing is that we've been working with international certification standards to ensure that they put in place worker protections, and that those worker protections are sufficient enough to provide protection for at-risk workers. And we've done this through showing the validation of our workplace practices and interventions, how they work, and also developing training material and toolkits for them to use. And that's really important because it means that any sugar mill across the world who wants to be certified by Bonsucro need to adhere to their worker protection. So this has been one of our key drivers in the last few years. We've also seen uptake of our intervention at other mills, which has been fantastic to see as well. Some challenges or lessons that we've learnt, probably the key one to highlight is that productivity needs to be measured. So we have to look at the economics around health and health interventions. And it was really important for us to address any real or perceived productivity loss that might occur through our intervention. And happily, we could actually show, because we track productivity and the economic portfolio, we could show our mill that for every dollar that they invested into the intervention, they actually got a 22% return. So that it becomes highly attractive to the mill and other mills to put this in place and sustain this intervention well after we're gone. So really important. However, we still have challenges. We are dealing with the perverse nature of piece rate work. So our workers don't get paid per hour, they get paid by how much sugarcane they cut. And this means that they are more likely to disregard safety regulations or their own feeling of wellness in order to provide and to get paid. So that's a real challenge for us, and I think a challenge for any precarious workforce or any workforce that's on the poverty line as well. We also learned early on that it was really important to engage early and regularly with all our key stakeholders, and that's a real focus of what we do. And so right before the inception and the design process, right through to feedback and ongoing outputs, we're challenging ourselves to always stay in contact and keep working with our key stakeholders. Of course, there's some things that you can't anticipate, and COVID-19 was certainly not something we had planned for, but it certainly has impacted our work in Central America. I think from our point of view, when the system comes under pressure, the first thing that went was the worker protection. So we saw the protection policies and regulations we had in place fall away when everyone was under pressure with COVID-19. So that's something for us to be aware of and look out for. Next steps, we're looking to maximise the intervention and try and make it as efficient and powerful as possible. We're also pushing forward with improving law and certification standards around worker protection and scaling our intervention to address different parts of the supply chain, particularly unregulated parts of the supply chain where we think there could be child labour involved as well. So that's our immediate next steps. Of course, we want to acknowledge and thank our funders without whom we wouldn't be able to do our work. And also, very important, we want to thank our participants as well, our research team. I'm one of a large research team, and our research partners. And thank you for your attention.